Hello, today we will be discussing the classification of diabetes mellitus. And indeed, you have heard about this illness before, but what really is diabetes mellitus? Well, to understand diabetes, we have to understand what happens when we eat. And usually when you eat, your body breaks down the food. So you have energy in your cells to go about everyday life. Okay? Glucose is a type of simple sugar that is the body's leading source of fuel, which you get after digesting the food, and it is stored as glycogen. And since your body needs glucose to keep running, glucose from the food is sent into your bloodstream. However, to get it into the cells, a hormone is necessary, and this hormone is made in an organ called pancreas, which is found in the abdomen region. And the pancreas is a long and flat gland that helps your body digest and absorb energy from food by producing hormones and enzymes. And one of the primary hormone products of the pancreas is insulin, which helps the glucose get into the body cells. So whenever the blood glucose level is increased, the pancreas responds by secreting insulin. And insulin does two intriguing things. It converts glucose to glycogen and increases the usage or metabolism of glucose in the cells. Thus, the glucose level falls and the blood sugar level goes back to the normal. And also, when the blood sugar level is low, the opposite happens. The pancreas responds by secreting less insulin, so there will be less glucose stored as glycogen, and it also produces glucagon when blood sugar is low. And glucagon is also produced by the pancreas, and this is a molecule similar to insulin but works as its counterpart, meaning that glucagon acts in opposition to insulin. So instead of moving glucose into the blood cells, it promotes an increased glucose in the blood. Diabetes is a disease now that affects how effectively the body uses glucose. So usually when a person has a diabetes, the body either cannot make enough insulin or doesn't work like normal. So the glucose is prevented from getting into the cells, causing the blood sugar level to be too high, leading to too many symptoms and complications if the person is not treated. And therefore, without insulin, the glucose is locked out of the body cells for a prolonged time and remains in the blood while the rest of your body cells are not getting the energy they need. So often, diabetes mellitus is diagnosed with a blood test finding high glucose levels in the blood. And when we speak about classification of diabetes, the standard primary diabetes mellitus syndromes are type 1 and type 2. Okay. Type 1 diabetes can also be called insulin-dependent diabetes mellitus, or IDDM for short, while type 2 diabetes is also known as non-insulin dependent diabetes, so NIDDM, and about 5 to 10% of people with diabetes have type 1, while the remaining 90% have type 2. And there's also less than 5% of people who may develop symptoms of diabetes due to pregnancy or other conditions that affect their hormones. And we will discuss that later when we look at the specific types of diabetes mellitus. Let's turn our attention now to type 1 diabetes. Type 1 is characterized by destruction of the beta cells within the pancreas. So these pancreatic beta cells are the cells that produce insulin. So their destruction leads to absolute insulin deficiency. And usually an autoimmune disorder leads to this destruction of the pancreatic beta cells. An autoimmune disease happens when the body's immune system attacks and destroys healthy body tissue by mistake. So when this occurs to the insulin-producing cells in the pancreas, it destroys our body's ability to make insulin. So with type 1 diabetes, one must take insulin to live, and it is believed that besides genetic element to development of type 1 diabetes, there is often an environmental trigger such as a virus. And in theory, certain viruses can cause diabetes, either through direct beta cell destruction or by inducing autoimmune damage. And usually chronic hepatitis C virus infection has been associated with this increased incidence of diabetes, but it is actually uncertain if there's a cause and an effect relationship. Sometimes type 1 diabetes is idiopathic, which means it came about spontaneously. or the cause is unknown. And most people are diagnosed as a child or young adult as it is inherited. Thus, type 1 diabetes used to be called juvenile diabetes or insulin-dependent diabetes. However, there can be a delayed type 1 diabetes in adults called the latent autoimmune diabetes in adults, or LADA. And latent autoimmune diabetes, so this LADA cases account for a tiny fraction of all cases of diabetes, and often adults diagnosed with this do not need insulin treatment immediately, but may need insulin treatment after several months to years after the diagnosis. And when people first have type 1 diabetes, they usually urinate or pee a lot. So this is called polyuria, because the body tries to get rid of this extra blood sugar by passing it out of the body in the urine. And they also drink a lot of water. This is called polydipsia, to make up for all that peeing. And they are found eating a lot. This is called polyphagia, because they are hungry for the energy they can't get from the sugar. And they might also lose weight as the body starts to use fat and muscle for fuel instead of glucose, because it cannot use sugar like it usually would. And that also explains why they feel tired, and this is called anergy, because their body cells cannot use the glucose for energy. And apart from characteristic symptoms such as with frequent urination, thirst and fatigue, insulin shock can also occur in type 1 diabetes, and insulin shock can be prescribed as a feeling of dizziness, sweating, paleness, and a diabetic coma is also possible, and this is described as partial or complete loss of consciousness. And treatment for type 1 diabetes involves insulin injections or the use of an insulin pump, frequent blood sugar checks, and carbohydrate counting or diet control. Regular exercise and a healthy lifestyle also are encouraged, as for all diseases. Now we focus on type 2 diabetes, which is a bit different. With type 2, the pancreas still makes insulin, but not sufficiently. So insulin doesn't do its job effectively in the body. And this ineffectiveness is known as insulin resistance, which causes issues with pulling glucose from the blood and putting it into the cells for energy. So glucose still builds up in the blood because enough of it cannot get into the body, into the cells, and as a result the blood sugar levels rise too high. The pancreas ends up making even more insulin to get glucose to go into the cells, and still eventually it gets worn out from working so hard, and ultimately this process will lead to dependence on insulin treatment. And type 2 diabetes is characterized by variable degrees of insulin deficiencies and resistance. And type 2 diabetes is by far the most common type of diabetes, and it is used to occur in all the populations, but now younger people are diagnosed with type 2 diabetes also. And a well-known risk factor of type 2 diabetes is obesity. So often type 2 diabetes is due to poor lifestyle, poor diet, and poor exercise habits. And its symptoms include frequent urination, thirst, fatigue, and sometimes even blurred vision and skin changes. And the treatment of type 2 diabetes mainly involves, we said, lifestyle changes, blood sugar monitoring, and diabetes medications, and also insulin sometimes. And sometimes it is difficult to differentiate if a patient has a type 1 or type 2 diabetes from just the clinical presentation, and such as the symptoms and blood tests. In such cases, the autoantibodies are checked. Now, autoantibodies are antibodies or immune proteins that mistakenly target and react with a person's own tissues or organs. And the commonly checked ones in type 1 diabetes are antibodies to glutamic acid decarboxylase 65, or insulinoma associated protein 2, or zinc transporter ZNT8. And another primary diabetes mellitus syndrome that requires diagnostic genetic testing is the maturity onset diabetes of the young, or MODY. And maturity onset diabetes of the young is a rare clinical disorder characterized by non-insulin dependent diabetes, and it is often diagnosed at a young age, usually below 25 years, and many patients with this MODY are misclassified as having either type 1 or type 2 diabetes. And the fault generates MODY1 in the HNF4 alpha gene on chromosome 20. MODY2 is caused by a defect in the glucokinase gene on chromosome 7, and the problem with the HNF1 alpha gene found on chromosome 12 is what causes MODY3. MODY4 is from a defect in insulin promoter factor 1 on chromosome 13, and MODY5 and MODY6, the defective genes are HNF1 beta on chromosome 17 or NeuroD1 on chromosome 2. respectively. And finding these genes is what makes the diagnosis of MODY clear. And as mentioned earlier, less than 5% of the population may develop symptoms of diabetes due to pregnancy or other conditions that affect the hormones. And these are the different types of diabetes that include gestational diabetes and secondary diabetes. And diabetes that happens during pregnancy is called, as we said, gestational diabetes, and it may occur when a woman without diabetes develops a higher blood sugar levels because the body cannot make enough insulin during this pregnancy. And in such a case, a woman's pancreatic function is insufficient to overcome both the insulin resistance created by the anti-insulin hormones secreted by the placenta during the pregnancy, such as estrogen and cortisol, and the increased fuel consumption necessary to provide for the growing mother and the baby. Okay, and this type of diabetes usually goes away after birth. However, up to 10% of women with gestational diabetes get type 2 diabetes weeks or even years later. And gestational diabetes is often riskier for the baby than for the mother. The effects on the baby can include having an unusual weight gain before birth called macrosomia, trouble breathing at birth called asphyxia, or an additional high risk of obesity and diabetes later in life. And the mother might need a cesarean section because of an overly large baby, and the complications of diabetes could also affect the mother in severe instances and leave her with damage to her heart, kidneys, nerves and eyes. So gestational diabetes treatment involves taking insulin or medication to control your blood sugar levels if needed, daily exercise, weight control, and care for meal planning. And let's discuss now secondary diabetes. Secondary diabetes can be defined as diabetes that results from another medical condition that can impair glucose tolerance and cause excess glucagon production or cause resistance to the action of insulin. And it can also be caused by a loss of pancreatic function in diseases that damage the pancreas or when parts of the pancreas are removed during a surgery, for example. The classification based on specific types of secondary diabetes can sound very scientific or technical. However, we will simplify them here. Remember that the causes of diabetes affect the function of the insulin hormone directly or through other hormones. And the cells that produce insulin and the organs where these cells are found, that is the pancreas. And therefore, it is understandable that the specific types are grouped by etiology or causes. And these are the genetic defects of a beta cell function or insulin action, and the diseases of the pancreas and endocrinopathies or hormone disorders also play a role. So the effects of medications, infections, and rare immune-mediated diseases can all lead to diabetes, and there are even other genetic syndromes sometimes associated with diabetes. And when talking about genetic defects of beta cell function, the word polymorphism has to be understood. Polymorphism is the ability of an object to take on many forms relating this to diabetes. And multiple genetic anomalies can cause varying degrees of predisposition to type 1 and type 2 diabetes. And numerous common polymorphisms for diabetes are approximately 50 to date, either weakly contribute to the risk for or protection from type 2 diabetes. And there are also complex polygenic risk factors, which means that dysfunction in several different genes can lead to the same result. And let us look at examples of these genetic defects. A genetic defect of a beta cell function can happen in mitochondrial DNA. And this genetic defect is maternally inherited diabetes and deafness, or MIDD, a rare mitochondrial disorder caused by a genetic mutation at the position 3243 in transfer RNA in the genes. And this can cause deficient insulin secretion and hearing loss between 30 and 40. Okay? Wolfram syndrome is another genetic defect and can also lead to deafness, diabetes, and several other problems. It occurs in about 1 in 700,000. And another genetic defect, I would say, is sulfonylurea 1 receptor subunit, or SIR1 gene. This defect causes hyperinsulinemia in childhood, but beta cell dysfunction and diabetes in adulthood also, which means people with this gene defect produce too much insulin as kids. However, they can barely produce insulin as adults, leading to diabetes then. Genetic defects in insulin action are a series of rare abnormalities in the insulin receptor or insulin structure, and these are often due to a genetic defect or or polycystic ovary syndrome, for example, PCOS for short. So polycystic ovary syndrome is a condition that affects a woman's hormone level, and usually there is a hormone imbalance here where women with PCOS produce higher than normal amounts of male hormones, okay? And this imbalance causes their body to skip menstrual periods and makes it harder for them to get pregnant. Additionally, they become more prone to develop, for example, diabetes, and as mentioned before, diseases of the pancreas can all lead to diabetes. So patients with pancreatic disease usually require insulin. And one primary example is cystic fibrosis. And cystic fibrosis is a hereditary disease that affects the lungs and the digestive system due to a gene defect. And the body produces thick and sticky mucus that can block the lungs and obstruct the pancreas, leading to scarring. And this scarring prevents the pancreas from producing average amounts of insulin, causing the diabetes. Hereditary hemochromatosis is another disorder that affects the pancreas, and at a diagnosis up to 50% also has diabetes in hereditary hemochromatosis. And the body absorbs too much iron from the diet here, and the excess iron is stored in the body's tissues and organs, particularly the skin, heart, liver, joint, and the pancreas. And chronic pancreatitis can also lead to diabetes. Chronic pancreatitis is a long-standing inflammation of the pancreas. Also, we have secondary diabetes can occur in hormone disorders or endocrinopathies such as Cushing syndrome that leads to abnormal glucose regulation and diabetes. And Cushing syndrome can be caused by overuse of cortisol medication and excess production of cortisol from a tumor in the adrenal gland or elsewhere in the body. Or we have cancer of the pituitary gland, for example. Somatostatin secreting tumors usually cause diabetes mellitus, gallstones, and fatty diarrhea. And since somatostatin is a hormone that stops the secretion of other hormones such as insulin, it makes sense then that a tumor producing a lot of somatostatin would stop insulin and therefore cause diabetes. Other hormone disorders that can cause diabetes include acromegaly, hyperthyroidism, and pheochromocytoma. In acromegaly, there's excess growth hormone in the body that causes then the initial symptoms such as enlargement of the hands, feet. We have also then hyperthyroidism that occurs when the thyroid gland is overactive and produces too much of the hormone, the hormone thyroxine, and so on. What do we have more? We have, for example, pheochromocytoma. This is a rare, usually benign tumor that develops in one or both adrenal glands and results in release of too much epinephrine and norepinephrine hormones that control the heart rate, metabolism, and blood pressure. So, medication can also cause secondary diabetes if they decrease insulin secretion or reduce the effectiveness of insulin. And in some instances, diabetes may be reversible if the medicine is discontinued. But it could also be the cause that the case that the drug-induced diabetes may be permanent. So once the medication is stopped, often blood glucose levels become more manageable. Corticosteroids and statins are examples of medicines that have been linked with an increased risk of diabetes development, and the corticosteroids are a well-known class of medications that lowers inflammation in the body and reduce immune system activity. And they are used to treat a range of conditions such as rheumatoid arthritis and lupus. However, corticosteroids can raise blood glucose levels, and if they are taken over a more extended period, it can sometimes lead to permanent development of type 2 diabetes. Statins are medications that are used to lower cholesterol. However, taking higher doses of statins medication causes a higher risk of type 2 diabetes. Type 2 diabetes. Thiazide diuretics or beta blockers and antipsychotics also play a role in secondary diabetes. Thiazide diuretics are taken to reduce high blood pressure or remove excess water from the body. However, one side effect of taking thiazide diuretics includes increased blood sugar levels here also. And if treatment with the thiazide diuretics is not stopped, then blood glucose levels may not return to normal. Also with beta blockers are also used to reduce blood pressure here, and they also function by blocking the release of adrenaline and noradrenaline, and are prescribed for conditions such as heart disease and hypertension, as we know. However, beta blockers can reduce sensitivity to insulin and increase the risk of type 2 diabetes developing, okay? Antipsychotics are used to treat schizophrenia, for example, and symptoms of psychosis, which may occur in people with dementia. However, a side effect of antipsychotics is high blood glucose levels here also. And it also causes weight gain, and if a significant weight has been gained throughout the treatment, then insulin resistance and type 2 diabetes may be permanent. So on rare occasions, infections may also cause diabetes, and certain viruses such as congenital rubella and cytomegalovirus can cause diabetes either through direct beta cell destruction or hypothetically by inducing autoimmune damage. So rare immune-mediated diabetes has also been classified, and this includes the stiff person syndrome and anti-insulin receptor antibodies. And the stiff person syndrome is an autoimmune disorder of the central nervous system, where 1/3 of the patients have diabetes with a trademark symptoms here. Okay, the symptoms are progressive muscle stiffness and rigidity. And also we have then this anti-insulin receptor antibodies can bind to insulin receptors at the cellular level, where they can block the binding of insulin, which causes then diabetes in some cases and cause then diabetes. Other genetic syndromes sometimes associated with diabetes include Down syndrome, we have Turner syndrome, we have Klinefelter syndrome, to mention just a few. In Down syndrome, for example, a child is born with an extra copy of their 21st chromosome, which causes then physical and mental developmental delays and disabilities. The Turner syndrome is a condition that affects only females due to one of the X chromosomes, which is a sex chromosome being missing or partially missing. And the Klinefelter syndrome is a genetic disease that causes males to be born with an extra copy of the X chromosome in their cells. So, adult patients with Turner syndrome or Klinefelter syndrome have a high risk of diabetes mellitus, and in contrast, children with Down syndrome are 4 times more likely to develop diabetes than other children. And now, I would say, let's make a summary of this whole presentation. Let's make some highlights here. Diabetes is a disease in which the body's ability to respond to the hormone insulin is weakened or impaired, affecting how effectively the body uses glucose and results in high glucose levels in the blood. Type 1 diabetes is characterized by the destruction of the pancreatic beta cells, the insulin producing cells here, leading to an absolute insulin deficiency. In type 2 diabetes, we have more characteristic of variable degrees of insulin deficiency and resistance, and often diabetes is diagnosed and managed by checking your blood glucose levels in a blood test. However, sometimes genetic testing may be required to confirm the type of the diabetes affecting the patient. And symptoms of diabetes include frequent urination, we have thirst, fatigue, and so on. Treatment for the type 1 diabetes, I would say, involves insulin injections or the use of insulin pump, regular blood sugar checks, and carbohydrate counting. Treatment of type 2 diabetes primarily involves lifestyle changes, monitoring your blood sugar along with diabetes medications or insulin in some cases, or both. And in gestational diabetes, a woman's pancreatic function is insufficient to overcome anti-insulin hormones secreted by the placenta, and then increased fuel demand during pregnancy. Also, the specific types of diabetes are caused by genetic defects of beta cell function, so genetic defects in insulin action, diseases of the pancreas, endocrinopathies or hormone disorders, and the effects of medications, infections, rare immune-mediated diabetes, and other genetic syndromes sometimes associated with diabetes. So I thank you very much for listening. Take care. Bye-bye.